This video demonstrates an inferior labral repair performed by Dr. Brian Tan. The patient is a young male who experienced shoulder instability after an initial shoulder dislocation. We start off with an arthroscopic view of the shoulder, looking from the back towards the front, and as we pan downwards, we start to see a large labral flap. So I've brought in an instrument known as a debrider. This is an instrument that oscillates as it sucks in tissues, and what it does is that it removes tissues in an atraumatic fashion so that the flap does not get in the way of shoulder movements in the future. Now we can see that the labral flap has been removed, and it's much easier to appreciate the extent of the tear now. Over here, I have brought the camera from the back towards the front, and we're looking towards the back now. This needle helps to serve as a guide to my correct direction so that I can get optimal angle to put in an anchor later on. And over here, I've brought in a series of instruments designed to help to freshen the edges of the tear such that tissues will have a nice clean surface to heal to. Here I've brought in an instrument known as a suture passer. It is really just a curved needle, and I use it to pass through the cartilaginous tissue of the labrum. Here you will see the tip of the needle as well as the stiff suture coming through. I then retrieve this stiff suture, and I will use the stiff suture to then pass through a much softer and a little bit thicker kind of suture known as a suture tape, which I will use for the final repair. And over here you see that I'm putting a drill with a sleeve through and making a very small hole in the edge of the glenoid. And over here you see the suture anchor, which I'm going to use to secure the suture in place. And the suture anchor is then put in place with a series of light taps using a mallet. And I'm using a cutter to cut the suture tape now. Could have done a better job with cutting it, but it does the job. And it is just a simple matter of repeating the same process again. This tear measures about 2 centimeters, so it required about 2 anchors to fix. This is the second suture anchor being put into place using the exact same steps as the first. And bringing in the cutter and doing a much better job with cutting the suture this time. This is the completed repair over here, and I'm just doing a final check to make sure that the repair is watertight. The patient should be pretty happy with this repair. Thank you.